So when we're looking at stress, be it at work, be it at home, in relationships, wherever it is, it's useful to think about stress as an equation and a relationship between demands and resources. So demands, for example, in the workplace would be things like deadlines, people in your team, people you're managing, people managing you. And then on the other side, your resources could be those very same people, mentors or people you can draft to help you, people who you can ask for advice. And then, of course, your inner resources, which would be trying to manage your time effectively, taking little breaks, making sure that you have a life beyond work, trying to get as much sleep as you need, trying to eat when you need to, keep hydrated. So there's a whole lot of stuff on the side of resources that you can do, because the demands aren't necessarily going to go away. What you can also do is perhaps once a week take stock of the week and look at what is my balance between my demands and resources, and what do I actually need? Have I got too many demands, too few resources? Have I got a temporary extra demand where I need to get another resource? For example, a deadline's been moved closer, so then I need to negotiate, doing another task later. So all of these things can be managed, and the best way to do it is to remember this equation, the relationship between demands and resources. If you'd like more information on this, you can go to www.thoughtsfirst.com and click on the stress face, and all of this information will be available there. So CBT stands for Cognitive Behavior Therapy, and this is a kind of therapy that is proven to work. It's evidence-based, which means there's research underpinning the techniques and the protocols. And it's also been proven to work especially well for anxiety, depression, bipolar, stress, anything mood-related basically. Also for negative behavioral patterns, substance abuse, that sort of thing, or even just bad habits. So CBT, Cognitive Behavior Therapy, focuses on shifting your thinking so it's more functional, and then shifting certain behaviors into a more functional space. So for example, with depression, you would have negative thoughts and you would have negative behaviors, as in being passive, not grooming. So these are things we would target. So how do you choose a CBT therapist? Well, CBT is a speciality like any other. And so what you would need to do would be to find out what is this person's experience with the particular thing you're dealing with. For example, panic, depression, phobia. How many of these have they seen? How experienced are they in this particular area? And what's their success rate? And a CBT therapist should be quite willing to have the conversation with you, because CBT is not only evidence-based, but the therapeutic relationship is very open and collaborative. So they should definitely be comfortable having that conversation. Secondly, you'd want to look at how much training have they had in CBT, because often people will do a workshop or two or read extensively about it, but they won't have had actual experience of hours of treating this particular disorder that you're dealing with. So you'd want to know, was the training local, was it international, what did the training entail? And again, a CBT therapist, being collaborative, should be quite comfortable to have that conversation with you. So if you'd like to know more about this, you can look on colindalinde.com. There's a frequently asked questions section, and you'll be able to find out more about it there. You can look on the SADAG website, or you can look on thecbtgroup.com, and there's more information on CBT there. What do you do when somebody's having a panic attack and they're right there with you? So the first thing to do is for you to stay calm. So keep your voice steady, keep your movement steady. If the person is with you and it's appropriate, you could perhaps touch their arm and just reassure them that you're there with them. Now, during a panic attack, it doesn't help to try and explain to the person that this panic only lasts 2 to 4 minutes, that it's not going to kill you, that the brain is not open to that at that time. So the best thing is to remain as a reassuring presence. That's one strategy. Another strategy that works incredibly well is distraction. So this is a quick fix. It's not going to be a long-term solution, but you're right there and this is emergency. So a quick distraction actually works better than probably anything else. So for example, when little ones are about to throw a tantrum and you say, there's a monkey in the tree, it will immediately shift their thinking. So you're not perhaps going to say that to a panic attack sufferer if they're an adult, maybe you will, but distraction works very well. So count backwards, spell a word backwards, or engage them in a story. Do you remember when this? So anything like that. And the reason for this is that panic is a vicious cycle between feeling really uncomfortable, feeling dizzy, all sorts of unpleasant feelings, and thinking that this is going to kill me. And this is a vicious cycle that keeps going and keeps setting up the next panic attack. So what you want to do with distraction is to actually block that cycle long enough that the person can almost process out all that adrenaline. So self-help for when you wake up in the morning and you've had panic for a period of time and you've got the fear of fear cycle thinking, what if I have an attack today? I might have an attack today. The first thing to do, please, is distraction. Why? Because if you keep thinking, what if I have a panic attack today? Am I feeling panicky? Those attacks are so terrible. 30 seconds and you've thought about panic 3 times. So you're going to eventually bring on those feelings and then you've got the panic. So distraction in this case would be very good. So try to get into a puzzle, do a task, make a complicated breakfast. Try to engage your mind in something else, which will be a very good distraction. If you need to, you can phone somebody. Don't talk about panic, talk about other things. Or you could distract yourself by counting backwards in 9s from 212 or a random large number like that. Or you could spell a very long word backwards like fantastic or something like that. And all of these are designed to shift the brain away from the habitual thinking, which would be, what if I'm going to have a panic attack?